Kampala has been credited by the advocacy group Save the Children for strengthening its healthcare systems and providing better care for mothers and babies before, during and after childbirth. But campaigners in Uganda warn a lot still needs to be done to ensure zero deaths, both in the city and in rural areas.
We see that the government is really endeavoring to set up health centers in Uganda in different parts of the country, even the most rural, but staffing is a problem. You'll find that some of the critical cadres, like midwives especially, because research has shown that midwives have a great role to play in the reduction of maternal mortality, and this is not happening. We don't see midwives being recruited and being remunerated and enabled, being provided the right working conditions that they require to do their job.
Uganda's demographic health survey shows maternal deaths are still very high at 438 for every 100,000 births. The child advocacy group also recognizes efforts by the Ugandan government to ensure hard-to-reach groups like fishing communities have access to essential health services. The government welcomes the report and concedes the provision of basic health services to rural communities still requires more effort.
Even when the mothers take a decision to go to the hospital, sometimes transport can be a challenge. And that's why we need the ambulances, we need the good roads, and we need to facilitate the mothers to be able to leave their homes and communities and reach the health care centers.
The report ranks Uganda down at 141 out of 179 countries for Uganda to have a safe delivery. Campaigners say Uganda's position is not good enough.
I don't think it's lack of commitment in terms of will, but put your money where your mouth is and where your heart is. So I think we need to see these different policies implemented, and that means that money has to be channeled to the health sector so that the doctors and the nurses and the midwives who are using torches to deliver babies can be able to do their job in a way that gives dignity to the women and the women they serve, but also them to enjoy their profession.
Uganda is now looking into providing emergency care for safe delivery in all its public health facilities. Researchers in Uganda said there is an urgent need to strengthen efforts to improve safe child delivery and newborn care if the country is to achieve better results. And until that is done, it's likely Uganda will lag behind in maternal health. Isabel Nakirya, CCTV, Kampala.